Senator Rand Paul began volunteering at TriStar Greenview Regional Hospital in Bowling Green earlier this week after recovering from the novel coronavirus himself.
I never had a fever, never had a body ache, never had a cough, and so I was one that you'd probably call completely asymptomatic. But I've enjoyed being back part of it. I spent a lot of my career, my office was right across the street from Greenview, and I spent a lot of my career coming over here, and it's for me been enjoyable to reconnect with a lot of the doctors in the community and the nurses.
We've been tickled to death to have the senator here. I mean, he's lifting the spirit of our patients and our colleagues.
Paul spoke with reporters outside the hospital on Wednesday, and he was asked about the possibility of a second wave of coronavirus cases if the United States eases its pandemic response restrictions too early.
It's going to be done with the advice of infectious disease people, so the scientists are intimately involved in this. You do have to do it at some point, and the hard part is that people are probably going to be dying of this virus, hopefully not very many, but in 6 months or a year. We can't keep things close, so someone has to make the decision. From my point of view, I think that we need to recognize that one size doesn't fit all. It shouldn't be the same solution. New York, obviously, it'd be a disaster to say, oh, open the schools tomorrow. We can't do that. But if you live in a very small town in western Kentucky with 2,000 people and you have no cases, would it be reasonable, yes, to start talking about? So we do need to talk about that.
He also responded to a question regarding Governor Andy Beshear's repeated statements about the federal government failing to provide enough personal protective equipment and either buying or diverting Kentucky's PPE orders.
This is a time when we really should try to work together as much as we can, both political parties, and not try to nitpick each other. There are their faults, of course. Nothing works perfectly. Like the testing could be better, but I don't think it's a time to try to score shots on it. So I'm not like criticizing FDA or the CDC or the president or anybody, Republican or Democrat. We do need to do better on the testing. The same way with the supplies. I think supplies getting better. We're really ramping up.
Reporting for WDNZ 11 News, I'm Emily Zanto.